Today we've been assessing the World Architecture News Healthcare Awards. The panel has had an interesting and somewhat demanding morning. This year's entries are unusual in as much as the entries substantially come from developed countries, from Britain and from across the world, but noticeably not from developing countries. And a number of the projects are of quite different nature to one another. We've had a combination of very large-scale hospital projects and tiny specialised healthcare, making it challenging, of course, as always, for the panel to choose an ultimate winner. We had a long list of 26, all of high quality, and eventually a short list of 6, which were really very exciting, all of them interesting and all of them challenging to us as a group of assessors. Our winner in the end came out partly because it was an unusual and we think probably a type of building which we're going to see more of, and partly because it very much demonstrated a humane and gentle view of healthcare as opposed to a technical and clinical view of healthcare. The winner being the National Centre for Tumour Diseases at Heidelberg by Danish associates, and it is a combination of research and treatment for a relatively small scale building for a group of people who will be both clinicians, patients and carers all under one roof and gathered around an atrium space which we thought was not at all clinical, quite interesting and quite a gentle space for healthcare and for the community that needs to gather around healthcare to work and live in.
Today we've been judging the WAN Awards Healthcare Sector Unbuilt category. We've looked at a huge variety of projects from all around the world, very varying standards from the fantastic to the not quite so fantastic, at different scales, in different formats. And after an interesting discussion this morning, we've come to the conclusion that the winning entry unanimously should be the Kenyan Women and Children's Wellness Centre in Nairobi in Kenya, for the very simple reason that it was the best scheme. It's a simple scheme overall, but very sophisticated in its response to the needs of its patients, the topography of the site, the microclimate of place, and is constructed in an appropriate technology for that part of Africa, rather than the building having to be imported from elsewhere. Also, as you dug into the drawings further, it was clear there are a number of subtleties in terms of its orientation and the way that the route cuts diagonally through the main circulation route cuts diagonally through the main blocks of accommodation, and that those blocks in turn slide backwards and forwards relative to that route, and the points where the route cuts through then actually enables the buildings to be modulated at the ends of the blocks to give a further level of interest.